Kluger, our Regional Director, to say an opening few words.
Good morning. Thank you for joining us today. It is over 3 months since the novel coronavirus gained a foothold in our region. Over 2 months since Europe first documented community transmission, and just over 1 month since we observed the virus move east across the European region. With a total of 1.6 million cases and almost 150,000 deaths, the European region accounts for 45% of cases and 60% of global deaths associated with COVID-19. I am sorry for the loss of every grandmother, grandfather, mother, father, sister, brother, son or daughter during these times. For almost 4 weeks, since 12 April, we have seen a decrease in the number of cases reported per day in the European region. Slowly but surely, we are seeing positive signs. Unfortunately, we cannot say this the same for all countries. The situation in the eastern part of the region remains a concern. Belarus, Kazakhstan, the Russian Federation and Ukraine have seen increases in new cases over the past week. This week, we have an expert mission on the ground in Tajikistan, working with national authorities and health providers to respond to the outbreak in the country. It is the latest of over 60 missions we have conducted across the European region during this pandemic, providing guidance on a range of technical areas, including laboratory testing, disease surveillance, operational planning, hospital preparedness, and of course, to help countries respond. Today, looking at the measures in place across the region, 43 countries have implemented partial or full domestic movement restrictions, and 32 countries are moving to ease some of the public health and social measures as they manage to suppress the transmission of the virus. The situation remains very fragile and could quickly relapse if the basic measures are not scaled up, their surge maintained, and if the transition is not planned carefully and gradually. The past month of restrictive measures and lockdowns have understandably bred stress and anxiety. Social networks are disruptive, and insecurity and financial strains with jobs in jeopardy. For many, uncertainty, separation, and fear are part of daily life. All of these factors compound the issue I would like to address today. WHO is deeply troubled by the reports from many countries, including Belgium, Bulgaria, France, Ireland, Russian Federation, Spain, UK, and others, of increases in interpersonal violence, including violence against women and men, by an intimate partner and against children, because of the COVID-19 response. Although data is scarce, Member States are reporting up to a 60% increase in emergency calls by women subjected to violence by their intimate partners in April this year, compared to last. Online inquiries to violence prevention support hotlines have increased up to 5 times. Our United Nations partner, UNFPA, has sounded the alarm loud and clear. If lockdowns were to continue for 6 months, we would expect an extra 31 million cases of gender-based violence globally. Beyond the figures, only a fraction of cases is ever reported. We talk a lot about numbers and statistics, but we must not for a moment forget the human side, the women and children who are living this reality day in and day out. Today I have 3 messages. First, to governments and local authorities, this should not be considered an option. It should be considered a moral obligation to make sure services to address violence are available and resourced, and expand hotlines and online services. Second, to communities and the public, violence is not a private matter. Stay in touch, contact and support your neighbors, acquaintances, families and friends. If you see something, say something. And third, to those experiencing violence. Violence against you is never your fault. It is never your fault. Your home should be a secure place. Get in touch safely with family, friends, shelters or community groups that have your safety and security at heart. There is no excuse for violence, and we must have zero tolerance of this misuse of power, be it physical, sexual, emotional, neglectful or financial. Violence of any kind and at any time against women, men, children or older populations must not be tolerated. Older women, people with disabilities, those who are displaced or are refugees, and those living in conflict-affected areas are especially vulnerable. Those are the people it is our responsibility to protect. Before the pandemic, in the European region, 1 in 4 women and 1 in 3 children had experienced physical and/or sexual violence in their lifetime. This is unacceptable. Evidence shows that interpersonal violence tends to increase during every type of emergency. This requires our urgent action. Out of school, at-risk children are off the radar of education and social sectors. With prevention and protection service on hold, those in need cannot access essential social services and care, nor be reached by those services. In lockdown, women and children are out of society's sight, but more exposed to perpetrators at home. The measures required to prevent the transmission of COVID-19 have challenged our ability to prevent and respond to violence when and where it occurs. However, there are examples where countries have addressed this. Italy has an app to ask for help without a phone call. Pharmacists in Spain and France can be alerted through code words. Hotels in France and Belgium have been converted to shelters. Greenland has limited the sale of alcohol to make the home environment safer for children. Also, sharing information on where to get help, increasing awareness of the signs of violence, expanding helplines, maintaining programs on social and parenting skills, following up on pre-existing situations can all make a positive difference. Let us share and learn from these examples. We at WHO have published guidance on what the health sector can do. In the coming days, we will be releasing an overview of key action now and in the future to prevent and respond to the surge in violence against children, women, men and older people. There is no single solution. This must be a whole of government and a whole of society response. With job losses, rising alcohol-based harm and drug use, stress and fear, the legacy of this pandemic could haunt us for years. So much related to COVID-19 has been unparalleled and is outside our control and understanding. But with solidarity, we can prevent violence from blighting the lives of generations. Shining a light on violence is a first step towards perpetrators being held accountable. Exposing this violence helps victims receive the justice, care and treatment that they need. Let me repeat. 1. Keep health and social services running. 2. Stay alert to the safety and well-being of those around you. And 3. Keep in touch with those you trust and can support you. And please remember that violence is preventable, not inevitable. Thank you.
Thank you very much, Regional Director.